All right, this is a patient that had an attempted sacroiliac joint fusion, and unfortunately, the pain doctor missed and put this into the iliac wing and not into the sacroiliac joint. And this is a case that was done under fluoroscopy. It's more difficult under fluoroscopy than one would think. They're trying to put it right in through here. There's a lot of overlying shadows, and as far as I'm concerned, with the technologies that we have available with navigation, computer-assisted stereotactic navigation, that's the way to go. So anyway, the patient did not have a sacroiliac joint fusion, just had the implant placed in the ilium, still has sacroiliitis, and we're gonna try to fix that. As you can see, the patient had a previous lumbar fusion, and I believe that this is probably harvesting of an iliac crest bone graft right here. All right, so now we've been able to move around the implant. So this is our axial view 3D. So as we're coming in, here's our first device, cannulated device, right across the sacroiliac joint right here. Here's the sacroiliac joint. So here we are here. It's our first device. And then we see the device that was placed in errantly. They wanted to come into the joint here, and there's a lot of issues about putting an implant directly into the joint and using it with fluoroscopy. It's more challenging than meets the eye, let's put it that way. That's why I prefer navigation. And then here we go below it, and we're able to shoot beneath it and catch bone on both sides. So that looks good. Our resistances were great on pedicle screw monitoring. So this is our sagittal or lateral view. And so here's our one implant here. Here's the implant that failed, it didn't go in. So you can see it didn't even cross the joint, it's just in the bone. And then our second implant is right there. And then if we look at our front back, or what we call coronal, you see them here starting out. There's a sacrum, you will go back, posterior, across the joint. And then this is our other, right here, that's the one that was stuck in the iliac crest that was kind of misguided. Anyway, so now the joint's fused. This should give this patient quite a bit of relief.